this is Dr. Shraddha, and today I would like to talk a few lines about pigmentation. Pigmentation typically on the face and the neck area. I know this is a vast topic to be covered, and there are a lot of things that I can actually talk about pigmentation, but I would just highlight a few things like the type of pigmentation and the basic treatment line that we can go about for each pigmentation. Now, the commonest pigmentation that almost everybody is worried about is the tan, sun damage, photo damage, or tan that we see typically on the face, even on the neck area. This is because of constant sun exposure, or not using a sunscreen, going out in the sun, traveling a lot in the sun, or typically after a holiday people experience tan on their face. So this kind of pigmentation can be taken care of with using a sunscreen. Now I know sunscreen won't reverse this pigmentation per se, but it will definitely help to prevent worsening of the pigmentation. And the other night creams, like some few lightening creams, could be prescribed for pigmentation. Also, certain chemical peels can be done after a certain amount of after a few days, after a few weeks of recent tan. And now the other kind of pigmentation that the most ladies are worried about is melasma or vang. That's the typical pigmentation that you see on your cheek and the nose area. It's a brownish kind of pigmentation that is seen. This is mostly after a delivery, post-pregnancy, and or when somebody suffers from a bad illness with a lot of medications going on. So it's like a stress to your body. So that can again give rise to pigmentation on the face. Now this pigmentation is a little difficult to actually go. We can take care of such pigmentation with combining various modalities together, like obviously using a sunscreen is of utmost important in melasma. Then there are certain peels, certain lasers which can help to control pigmentation, to lighten it to some extent. Then the third kind of pigmentation is the post-acne pigmentation. This pigmentation is like a brownish or a reddish pigmentation seen after an acne or a pimple. This is comparatively easier pigmentation to resolve. We can start with chemical peels and certain home care which helps in such pigmentation. The other pigmentation is your sun spots or freckles, that is seen on your cheek area. There are small brownish flat pigmentation spots which are seen. This is also because of sun damage. This pigmentation, we can use lasers for treating such pigmentation. So this is like certain genetic conditions can also give rise to pigmentation, like protein deposit under your skin can cause a diffuse pigmentation on the face and the neck area. So this is more or less a quick go through pigmentation. And yes, we would be covering certain other topics in our next videos also. So I would just like to mention that please consult a doctor before going ahead with any kind of treatments. Don't buy any over-the-counter medications. Go to a doctor, get yourself analyzed, the kind of pigmentation that you're suffering from, and then get it treated accordingly. So I'll see you soon in my next video. Thank you.